Good afternoon. Thank you for joining us. My name is Harry Tatonis, and I'd like to welcome you to this press conference at mHealth. I lead a company called Surescripts, and Surescripts is the nation's e-prescribing as well as clinical information network. About a year ago, when Farzad called me to talk about the Million Hearts program and challenge, my response was, we absolutely have to support the Million Hearts campaign, because at the end of the day, it's all about connecting healthcare and putting the patient in the middle. So we've worked with Farzad and with a lot of other people to make sure that Million Hearts campaign is successful. I'm very proud to also announce that numerous pharmacies, including Walgreens, H-E-B, Thrifty White, NCPA, and CVS Caremark Minute Clinic have joined us to make sure that we connect patients with healthcare. I would like to turn this morning the microphone over to my colleagues Farzad, Janet, and Jason Adler to talk a little bit about the Million Hearts campaign. Farzad?
We always start with the why. Why are we doing what we're doing? It's not about the technology for us. It's about saving lives. It's about improved care, better health, and lower cost. And we can't do that without engaging the most underutilized resource in healthcare, which is the patient and their uncompensated caregivers. People who care about the health of that individual more than anybody else ever will. And this is, to me, the most brilliant example of how we can harness innovation. We're going to win through innovation. And what we're going to do today is open up and be open. Open means letting others help. And we're going to open up and we're going to say, we need help to get people to know what their risks are and to take steps to reduce their own risks of having a heart attack or a stroke. And the way we're going to do this is through openness, an open challenge that it features open APIs that make available to every developer, every smartphone, every person in this country who can bring this with them to say, you can now have access to the most amazing big data, predictive analytic models through Archimedes. You can have instant access to know where you can go to get your blood pressure and your cholesterol measured, and you can have access to the best algorithms ever decided to understand what is your risk and what you can do about it, and then connect you to the appropriate care setting. So this is just the first step, but we're very excited that by January, we're going to have the finalists. We have now 5 selected finalists. By January, we're going to narrow it down to 1, and we're going to pilot this in cities like Tulsa and Chicago and Baltimore, and we're going to make this really available as broadly as possible. But this is just one example of how knowing where we want to go, but having our feet on the ground and being open to the innovation and the startup potential of the American people is going to lead us to where we need to go, which is better health and better care at lower cost. Thank you. To our champion for the Million Hearts program, Janet Wright.
Thank you, Farzad and Harry. And I want to thank the extraordinary partners in this Million Hearts Risk Check Challenge, those being Surescripts, Archimedes, and the Office of the National Coordinator. Million Hearts is about preventing 1 million heart attacks and strokes by 2017, and we're at the end of the first year, so the heat is turning up on delivering that goal. I'm extraordinarily excited about this partnership because what I see happening is that we're putting the power of heart health in the hands of the people who can have the greatest impact on that health, and those are our citizens. We're actually making it easier. The new technology and the applications that are exciting and engaging actually will help people demystify this process that we call risk assessment. I think there are millions of us lying in bed at night, especially after we've had a loved one have a heart attack or stroke, and we wonder what our own risk is. This app is meant to overcome the inertia and make it easier for people to understand that risk. So, it is an example of one of the fundamental pillars of Million Hearts, that being team-based care. We know that the Community Preventive Services Task Force recommends team-based care. That is the patient and family and the people in that person's circle, along with their doctors and nurses and pharmacists. This technology is going to enable that group to take great control of their blood pressure and their cholesterol. I'd ask all of you to take a first step today. At the Surescripts booth, we have 2 members of the Chi Eta Phi sorority, our Million Hearts partner, taking blood pressures. Once you know that number, I want you to share it with a healthcare professional that can help you get and keep your blood pressure under control. And I'd like to issue a bit of a challenge that at next year's mHealth Summit, we don't check blood pressures and give someone their blood pressure reading on a piece of paper. We actually have the technology to get that blood pressure back to the treating provider. We only have a year to make that happen. So I will turn it over to Josh Adler.
Thank you. Thanks, Janet. We're very delighted to be working with John and Farzad and Janet on this very impressive initiative. At Archimedes, we believe health outcomes can improve if you get people activated to take care of their health. At Archimedes, we provide analytic tools and solutions that we're going to put into this new consumer application at the fingertips of individual consumer to help them understand what their risk of heart attacks and strokes are and the specific actions they can take to reduce that risk, both behavioral and medication. We think this is critical in getting patients and consumers to take control of their health and create a sense of ownership in their healthcare decision making. We're very excited to be working with this group of individuals and these organizations and the app developer to try to drive improvement in health by providing actionable interventions that people can take to drive reduction in costs and improvement in quality. We congratulate the 5 finalists and look forward to working with this organization on the Million Hearts campaign. Thank you.
Thank you. And I have the pleasure of announcing the 5 finalists, and as far as that said, in January we're going to announce one winner to make this happen. So the 5 finalists is the drum roll. Thank you. mHealth Coach, X Bio Lab, Marshfield Clinic Research Foundation, Alexander Blair and team, and Pharma Smart International. Congratulations to the 5 finalists, and we look forward to moving to the process to the next step and identifying one final winner. And with this, I would like to open it up for more questions for anybody.
Let's give them an applause.
Are there any questions for anybody? You can't, you know, the audio, there's just too much noise.
How does a practicing physician
Access the app.
We talked about Tulsa and other.
Yes, we're going to be working with 2 beacon communities, both in Tulsa and in Colorado, to give them access to this Indigo application that they can access through their mobile application. So at the point of care or when the patient goes home, the physician can instruct the patient to use the application to understand what their risks and the benefits from various interventions to improve their health.
Thank you. Any other questions?
I have a question. This is a plant. Of all people with poorly controlled blood pressure, say, Dr. Wright, how many people have it under control, and how many people know that they even know about it?
Right. So 67 there's 67 million Americans with high blood pressure. 67 million. Fewer than half have their blood pressure under control. And that's a really generous definition of control, less than 140/90. The really frightening thing is, of the 36 million people who do not have their blood pressure under control, 14 million don't even know they have high blood pressure. That's one of the things, that's one of the numbers that we hope to drop precipitously with the use of this app.
Farzad, I have a question. You started it, so I thought maybe I can continue. What are the process and what are the things do you expect to happen in order to announce the winner? What can we expect between now and January?
Well, I think we're going to take a look at the different applications. A lot of the guts of the intelligence of it and to be able to find it are dealt with through the APIs, through these world-class leading analytics and directories. And so the focus for the app developers is really to understand how best to engage the patient, the consumer, how to make an application that is designed to be sticky, that is designed to be attractive, that is designed to be able to be spread through the distribution channels we already have, through our phones, our mobile technology, and we're here at the mHealth conference. And those are going to be, I think, some of the most important ways in which the assessment of these apps is going to take us. Which of these 5 apps is going to give us the best shot of getting this into the widest possible distribution in our pilot cities and our best shot at actually seeing behavior change at the end of the day.
Great, thank you. And Janet, I have one other question. I know that in speaking to the pharmacies, they're very excited about this and it's top of mind. What else are we going to be doing collectively as a nation to get the message out and get the consumers to actually use the application?
Great, so a couple of things. First is we have 5 cities around the country that have agreed enthusiastically for the next year to promote the use of the app in their cities. That's Tulsa, San Diego, Baltimore, Chicago, and Philadelphia. In addition, there's a program reaching out to both pharmacists and to the public called Team Up, Pressure Down. It's a campaign to inform everyone of the role that the pharmacist can play in medication adherence and specifically in helping people get their blood pressure under control. Resources for Team Up, Pressure Down are on our website, millionhearts.hhs.gov.
Great, well this is terrific, and this is a perfect example of actually putting the patient in the middle. If there's nothing else, thank you very much. Thank you everyone for joining me this afternoon.